welcome back to Method Monday with Ethereal Skin. My name is Taylor and I have been in aesthetic medicine for 5 years. Today we are going to be going over everything microneedling. What is microneedling? We're going to be sharing case studies with you, all of the information steering you in the right direction. So you better understand what microneedling is. There's a lot of buzzwords with certain medical grade devices that just simply aren't true. We're here to spill all of the tea and factual evidence to better help you pick a device that you're actually going to get a benefit from that is effective. And I want to emphasize the word effective in medical aesthetics because not everything you see with a buzzword, not everything you see with a medical grade device is simply fitting for your needs or even efficient, unfortunately. So we're here to tell you the truth about all things aesthetic medicine. Let's get into it. So first, I want to go over this. It's called the SKINPEN Microneedling. This is without radio frequency. This is simply just a handheld device. And I want to emphasize that microneedling was not FDA cleared until 2018, guys. If you had microneedling done before 2018, God knows what you would have had. It is so important to understand these devices when your providers or clinicians are talking to you to make sure that they're effective. You want to make sure that this investment is going to suit you long term. Microneedling has actually been trying to be studied and performed and perfected since as early as the BC years. And there's a book, it's called Yellow Theory of Internal Medicine by Ancient Chinese. And this book is incredible. It's based off of diseases and overall health. Needles are actually healing to the body. And this is where microneedling started. It's important I give you some backstory. So the first microneedling device actually launched in 2000. It was the derma roller, which I'm sure you guys all have seen this device. We're gonna enter a picture here. And this was a device that is not cleared. It is not effective. It was effective back then, but not to the standards we have now in aesthetic medicine. So the first case study ever launched in 2004, guys. So think about all of the research and studies people have been trying to get their hands on since. A few of my favorite case studies are whenever you do a series of microneedling treatments for the next 6 months. After that 6 months, 1 month apart from getting each treatment, your collagen spikes by 400%. And another one of the case studies I want to share, this is more regarding derms, skin health, things like that, and more of the medical side. There is an infarticular follicular dibulum. And another one of my favorite case studies, guys, is regarding a benign tumor, probably more familiar in dermatology, but it's follicular infundibulum. And this is a benign skin tumor that is usually found in a little bit of an older patient. The case study and why I found this fascinating was the microneedling has actually expanded that follicular infundibulum by 47% of the product medication absorption rate, helping to actually cure, right, what that tumor is. And I want to emphasize this, guys, is because for that case study to expand that to 47%, what do you think it's doing for product absorption, guys? I mean, it's incredible, the studies that people are really honing in on with microneedling. So I think it's incredible. And let's talk about a few other brands that are pretty known that is not really considered microneedling anymore, that is not safe, it's not effective, with the SKINPEN now being things like the Derma Pen, the Derma Roller, Candela, Exceed Microneedling, Code X, Derma Pen. I had to write them down, guys, I'm sorry. I don't sponsor the brand, so I did not know them off of the top of my head. These are things you want to look out for, right? Is somebody telling you that they have microneedling? Ask what the brand is. Ask them to give you a pamphlet, you to read up on it on your own terms. So if you're asking questions like, well, Taylor, what's the downtime? Well, the downtime is about 72 hours, give or take. I tell you to keep your face clean. Our patients here, we send home with antimicrobial spray, making sure that surface is clean, free of any type of bacteria. But ideally, I'd say about 4 to 7 days of downtime. You're gonna be a little bit red, you can be a little bit sore like sunburn. But technically, how this microneedling device works is 14 precision-based medical needles going in and out of your skin while you're numb, really not gonna feel it. Pain level is a 3 out of 10, and it's utilizing 98,000 microchannels per minute. This is why microneedling is so effective. Let's get into why is microneedling effective and who is it for. Anybody struggling with anti-aging, acne scarring, hyperpigmentation, PIH, which is post-inflammatory hyperpigmentation, maybe from an acne lesion, nick or injury on the face that left a little bit of a scar behind. This is for anybody with enlarged pores or texture. Microneedling is so innovative and I love it. You can do it anywhere on the body. It's great for any type of skin with the proper depths. How can this replump you? How can this build collagen and elastin? How can this help with acne scarring? If you're like, what are you talking about? I'm gonna tell you exactly why and how this device can do just that. So technically, whenever you start microneedling, blood's going to flow to that treated area. White blood cells are then going to clean out any debris or bacteria, and then new blood cells are going to form from things like pre-existing blood cells. And this process is typically known as angiogenesis. And this is technically the development of new blood cells. This process then stimulates the migration of fibroblasts and surrounding areas while stimulating new fibroblasts, which is really important. Then this is going to develop into type 3 collagen. Wound healing collagen, guys. So the collagen is still maturing for 30 days. It's really at its peak on day 30 and it turns into type 1 collagen. I want to talk to you about what is the difference between type 3 collagen and type 1. So type 3 collagen is found in your muscles, it's found in your organs and arteries, and this is considered the immature collagen in your body. Type 1 collagen is 90% of our body. This is on our skin, in our bones. This is what our body in a fountain of youth is really made of. This is helping with skin integrity and elasticity, guys. So the development from collagen building with just SkinPen is absolutely incredible. And I need you to remember it goes from type 3 to type 1 in just 30 days. So your skin's integrity is improving, the elasticity, and the collagen then starts to rebuild in type 1 collagen since it's not as hydrophilic, right? Which hydrophilic is attracting water. It's more consistent. I always like to tell my patients between 3 to 6 treatments to achieve the best result. And then after your last treatment, about 90 days after your last treatment, you will be at your peak. You will see almost the full benefit of microneedling, and it is absolutely incredible for any age, for any skin concerns, except any open lesions, active cancer, some type of dermatitis on the face, or active herpes or lesions, and active acne. Anything with autoimmune, depending on your situation, scleroderma, anything that is rapidly increasing that collagen, we need to stay away from. That's considered a contraindication. I love SkinPen. It's one of my absolute favorite treatments. It's great to pair with things. If you're asking, well, Taylor, can I get more than one thing done when I'm getting SkinPen? Of course. We can pair chemical peels. We actually will microneedle. We can microneedle a chemical peel in, or we can do it on top after. We can do things like laser. It's truly incredible what you can do with SkinPen, and I hope I answered your questions. Thanks for talking, and I'll be back next Monday to tell you some more about aesthetic medicine. Chat soon. Bye.